Hello, sir. Good morning.
Good morning.
My name is Dr. Saha, one of the PACES candidate here today. I have been asked to examine your lungs and chest. So what I'm going to do, I'd like to have a very good look first and then feel, then tapping and listen to your chest. So do you have any pain at your chest right at this moment? No. All right. So during this procedure, if you have the pain and discomfort, just let me know and stop at that moment. Is it all right? Yes. Thank you very much, sir. So my dear doctor, listen very carefully. Immediately enter in the room that you need to go through the G bundle bag. Greetings, introduction, instruction, pain, position and posture. So I have done finish after the pain management. Now the position. And position is 45-degree angle. You need to make the head for the 45-degree angle. And then after that, exposure. Immediately after the positioning, the 45-degree angle, then you need to tell him, sir, regarding the posture, means the exposure, my dear. Sir, would you mind just put a few shots so that I can examine you? Is that all right?
Yes.
Yes. Can you sit forward for me? Now you're ready to start your examination after exposure, my dear. So the deep bundle bags, you must do that. Immediately after that, your examination should be started. For the respiratory system examination, my dear, the approaches that we learn, that is really important. That starts from the symmetry, epidiameter, crackles, and then asymmetry, scar, and the trachea. And then once again, the asymmetry with no scar and the Darwin percussion. So that's the simplest approach, my dear, that you need to learn. So let's start with the symmetry, starting from the symmetry. So I need to go through the end of the bed and to look here and tell him, turn your head on the left side for me. Yes. And take a deep breath in and out once again. Yes. So on an inspection, that what I'm observing, there's really obvious things that the young boy having some of the symmetrical chest expansion and having a scar, a thoracotomy scar, a continuous thoracotomy scar, bilateral thoracotomy scar toward the sternotomy as well. So this is a clamshell scar, and this scar is for the double lung transplantation. So as a spot diagnosis, my dear, you need to know, you have seen the instruction that is written here. This young man with a history of diarrhea, examine his respiratory system. So my dear, listen very carefully. In a station respiratory system, the history of diarrhea or chronic diarrhea with the respiratory system problem, so we should think about the diagnosis. The diarrhea means the malabsorption and the respiratory system is the bronchiectasis. So both together, the first diagnosis, cystic fibrosis. What I said? Once again, the two important systems is the respiratory system and the GI system. My dear, listen very carefully. The respiratory system, recurrent respiratory tract infections leading to the bronchiectasis and the GIT problems, especially the diarrhea means the malabsorption. Malabsorption means the weight loss, diarrhea, steatorrhea. So having these combinations, the first differential diagnosis, that is the cystic fibrosis. The second differential diagnosis we need to learn, that is hypogammaglobulinemia. But the first diagnosis is the cystic fibrosis. With the cystic fibrosis patients having the long list of features altogether, and you entered the room, these are the clues to reach your diagnosis. The young boy or young man having the respiratory problem, having the diarrhea, and if it is bronchiectasis, so the spot, the diagnosis, this is the underlying etiology of bronchiectasis, is cystic fibrosis. So what I have seen, that I have seen from the food and bed, there is a chest expansion symmetrically. Symmetrical chest expansion, which is normal, that I have seen. And having a clamshell scar that I have seen. So definitely the diagnosis, the double lung transplantation he underwent, and the young boy having bronchiectasis that leading to the lung damage to that extent that needs the lung transplantation, the double lung transplantation. Cystic fibrosis involving the lungs in a variety of ways. We need to know that the bronchiectasis is one of the important points, the cystic fibrosis, so that we can know The cystic bronchiectasis and fibrosis means the fibrotic lung changes as well. So the both together can be found in cystic fibrosis. And there are varieties of lung or the respiratory complications done by the cystic fibrosis. We'll discuss in another video clips, my dear. But the most important tips and tricks that I'm saying, my dear, the diarrhea with the bronchiectasis or bronchiectasis with the diarrhea, the first diagnosis is the cystic fibrosis, and second one is hypogammaglobulinemia. And cystic fibrosis will have some of the important features. Short stature, this is important, my dear. And the stunted growth, short stature is one of the important points. In the young boy, the short stature, stunted growth. So yes, first diagnosis should think about the cystic fibrosis. Hypogammaglobulinemia is the second differential diagnosis. It says the gamma globulin is reduced. It does mean that the patient is exposed to the recurrent infections because the gamma globulin is the protective, the antibody. Because of the reduced antibody or hypogammaglobulinemia, the two important systems, you see the respiratory system, this is the GIT system, two systems are exposed to the environment, and this environment is infecting these two systems, with the respiratory system starting from the nose to the lungs, alveoli, and from the mouth to the anus. So these two systems is exposed to the environment, the noxious environment, the infectious environment, and that leads to the recurrently infecting and damaging these systems, leading to the various categories of the symptoms and the diseases altogether. So this is the hypogammaglobulinemia. So that's why these two important diseases that we need to learn, once again, the box. So the bronchiectasis and malabsorption, the first diagnosis. There is the cystic fibrosis, second means second, is that is the hypogammaglobulinemia. So having this knowledge, you enter into the room, that you have seen the history of diarrhea, the young boy, having the respiratory system and having the double lung transplantation scar. So yes, the diagnosis, spot the diagnosis, the cystic fibrosis. Now start the examination from the hands, my dear. So the examination starts from the hands that you need to start. You need to tell, sir, could you please do like this for me? Like this. And put in my hands to see the clubbing, my dear. So we are expecting the clubbing. So yes. So we are expecting the clubbing here. So yes. His fingers are clubbed. You see the fingers are clubbed. So he has got the clubbing. And also we are looking for the other bundle packs of the cancer bundle packs. But he has no features of other cancer bundle packs. But what we have found that he has got the fingertip pinprick. You see the tiny hands. So he has got the fingertip pinprick. And here is also some of the fingertip pinprick here. And this is the evidence of the diabetes glucose testing. So if you get down, so we can see the fingertip pinprick. You see the fingertip pinprick for the glucose testing. The right middle finger as well as the left middle finger as well. Some fingertip pinprick, you see. So we have found the evidence of the diabetes. So this young boy has got the diabetes. So because of the fingertip pinprick, and that we need to look for the bedside any glucometer, any insulin syringes, and the fingertip pinprick and the urine dipstick as well, and also the ophthalmoscope for the diabetic retinopathy. But the fingertip pinprick that we found that he has got the diabetes. And we need to compare with the hands so that we can see he has got the pallor of the hands. You see the pale skin. In compare with my own, you see the pale. So he's got anemic as well. So he's got the anemia and the fingertip pinprick, the two important findings that we found. And then you need to put the hands for the warm hands and the pulmonary erythema, no pulmonary erythema, no warm hands, and you need to feel the pulse for the bounding pulses. So he has no bounding pulses as well. And now we need to see the flaps. So you need to the flaps as well, you need to hold it here to give it back pressure. So he has no flaps. So he has no carbon dioxide retention findings. So in hands, the examination that we found, the fingertip pinprick, as well as he has got the clubbing and anemic So the three findings that we found. So after having the hands examination, what we have seen that he has got a breast slide, and this breast slide is a medical breast slide, and it's written, you see very clearly, it is written there, the double, you see the lung, it is written that you see the transplantation. So this double lung transplantation, he underwent the double lung transplantation, might be one of the important tips and tricks that he has undergone the double lung transplantation. So medical breast slide shows that. So whenever you have the breast slide or any ornaments, my tips, SS tips is that you need to look into them, what is written over there, so that you can make your diagnosis. So in the antecubital fossa that I have seen, there is a small cut marks, the small previous scar mark, is a previous vascular access for the long-term antibiotics. Yes, you see the scar mark here for the long-term antibiotics. So it's a previous vascular access for the long-term antibiotics, and this kind of vascular access or scar mark that we can find on the upper anterior chest wall as well. So from the left hand that we can see here, the left forearm, he has got some skin bruises. You see the easy bruising here, and the black color. You see the skin bruises is nothing but the steroid bruises and also the skin thinning. So the steroid bruises. So he may be on steroid right at this moment. So this is the steroid evidence. So the steroid evidence is you need to look for whenever you have the bruises and the skin thinning, as I said, and also you need to look for, and sometimes the Cushingoid fasces, and also you need to look for the steroid card at the bedside. So there's important steroid card at the bedside, and also he has got the steroid card at the bedside as well, and so he's on steroid right at this moment. Yes. And also that along with the skin bruising and the skin thinning and the steroid card means he is on steroid right at this moment. So this is the steroid card that I found at the bedside of this young man is on steroid. That is the evidence. So yes, my dear doctor, if you have the steroid card at the bedside, so you can understand that this gentleman or man or this patient is on steroid. So this is the evidence of the steroid evidences. So immediately after that you need to look at the face, that you need to look at the eyes for the anemia. I need to tell him, look up for me. So he has got the anemia. So he has both eyes, you see the anemia, he is anemic. And can you look down for me? Look down. So he has no jaundice. Now can you stick your tongue out for me? So he is anemic, tongue up. And show me your gum. Yes. So he has no gum hyperplasia, but he has got the anemic, and he looked to be a malnourished and also the pale looking and also the lean and thin body. So all our findings are going in favor of the cystic fibrosis. So immediately after that, the phase that we have seen, the anemia jaundice and gamma hyperplasia, but we found that he has got the lean and thin and the pale looking and also having some of the anemia, but no other findings at all. Now the chest proper examination, that you need to put your hands to feel the trachea, and the trachea is the central, just feel the trachea. Trachea is the central position. So now the chest proper examination that you come for, you see, on chest examination that we have seen that he has got a scar mark, as a continuous scar mark, that the bilateral thoracotomy scar involving the sternum as well. So yes, so we call it the clamshell scar. And this clamshell scar is for the double lung transplantation. And if you get closer, we can see the scar mark here. So this from the right side, from the axilla as well, and up to the left side, you see. So this is the scar mark for the double lung transplantation. So now, dear doctor, listen very carefully. As I said that the CP and BSBR, you need to comment on them, the chest expansion, percussion, note, breath sound, and vocal resonances. So you need to hold it here on the apical zone. Then you need to tell him, take a deep breath in and out for me. So see that he has a very good chest expansion. Once again, yes. Now in the middle of the chest, once again, take a deep breath in and out. So see, the very good chest expansion. Once again. Yes, once again. So see, once again. So yes, he has got a very good chest expansion. And now the percussion note that you need to tell him that I need to tap on your chest. So this is a resonant sound. Resonant, 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 resonant sound. And on the exhale as well, the resonant. So the normal findings. So immediately after the C, P, and then the PS. You need to tell him, take a deep breath in and out. Once again. Once again, take a deep breath in and out. Once again. Once again. Once again. Once again. Once again. Once again. Excellent, Rider. Now the VR for the vocal resonance. Sir, could you please tell 99 for me?
99.
Alright, thank you very much. Just turn your head. Say 99 for me.
99.
Once again.
99.
Once again.
99.
Once again.
99. 99. 99. 99.
Once again.
99.
Once again.
99.
Once again.
99.
Excellent. So immediately after that, the CP and BSBR, that you found that the findings are absolutely normal bilaterally. All the chest expansion, percussion note, and the breath sound and the vocal resonances are absolutely normal. No other abnormal findings that we found. Immediately after that, you need to examine the back for the CP and BSB all together. So immediately after the front chest examinations, my dear, you need to examine the back for the CP and BSBR all together. So what I say, the C, P, and BSBR. So let me start from the C, chest expansion. So you need to tell him, take a deep breath in and out for me. So you see, once again, take a deep breath in and out, once again. Once again. So the normal chest expansion, you see, it is said that more than 2.5 cm chest expansion is normal. So immediately after the chest expansion, the percussion note, you need to tell him, so I'd like to tap on your chest. So normal resonant sound, percussion note. And immediately after that, the breath sound. Then you need to put the stethoscope. They are the similar places and tell him, take a deep breath in and out. Once again. 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 So the breath sounds normal. Now the vocal resonance, the CP and BSBR. So sir, could you please tell me 99 for me? 99.
99.
Once again.
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 99.
So these are CP and BSBR, the findings on the back as well as the normal, no abnormal findings that we found. Immediately after the examination that he finished, then you need to just hold here for the anterior chains and the posterior chains and the supraclavicular lymph nodes, right? And the lymph nodes are not enlarged, not palpable. Immediately after the lymph nodes, that we need to see the leg edema. So immediately after that, you need to hold to see the leg edema, and you need to tell that is it painful, and he has no leg edema at all. Immediately after that, you finish the examination, you need to give the clothes back. Yes, you sit for a while and give the clothes back, and you can help him to wear the shirt and tell him, sir, you've really done really excellent for me, and give a good thanks Very, very good. Thanks, sir. Thank you very much. So give the clothes back and say that thank you, and you have done really excellent. Saying that the word of the excellent makes the full environment excellent. Whenever you felt you finished your examinations, my dear, you need to wash your hands. And now you need to take the stethoscope off. Yes, my dear. And then you start your presentations. I need to tell that, sir, I'd like to finish my respiratory system examination to do the bedside spirometry and bedside arterial blood gas analysis. And I would like to finish my full examination to check the observation chart that includes the PTR, BP, SpO2. It includes the pulse, temperature, respiratory rate, and oxygen saturation and blood pressure. And also I'd like to do the urine dipstick for the sugar, protein, RBC, nitrites. Saying them three important bundle packs here mean that if you finish your examination, you will get the full marks in the examination section by the examiners, my dear. Immediately after that examination, we'll ask you so many questions, or maybe that you need to present your case. So you need to present your case, my dear, the way that I'm presenting. My clinical diagnosis of this young boy with a history of diarrhea is double lung transplantation, as evidenced by there is a bilateral thoracotomy scar, continuous scar with the sternotomy scar, with the clamshell scar. That has mean this young boy underwent the double lung transplantation. Along with the double lung transplantation, the chest findings, including the trachea and the chest expansion, percussion note, breath sound, and vocal resonances, are absolutely normal findings without any added sounds that I found. Along with that, I found some of the important findings. The fingertip pinprick, it does mean this boy having the diabetes mellitus, the glucose testing at the bedside. And also he has got the insulin syringes and the insulin pen-filled insulin at the bedside. And also I have seen that he has got the glucometer at the bedside. So these are the core of evidences that I found that he has got the diabetes. And this young boy has got the clubbing, the fingers are clubbed. It does essentially mean that this young boy having the bronchiectasis earlier. And because of bronchiectasis, the clubbing that we found. And for this bronchiectasis, necessary to go for double lung transplantation. And also I have found this boy also having the features of clinically he is anemic and also pale looking and the thin, malnourished and the short stature and having the growth is stunted. So the underlying etiology of the bronchiectasis and also having the history of diarrhea with the GIT involvement and having the short stature, thin and pale altogether, and also having the pale means the anemic. So I think the underlying etiology of the bronchiectasis is cystic fibrosis. And also I have seen he has got the medical address slide that is written there, the double lung transplantation that has been underwent. And also I have seen this boy also is on steroid right at this moment, as evidenced by he has got the skin bruises and also he has the steroid card at the bedside. So my clinical diagnosis of this young boy is bronchiectasis as evidenced by the clubbing. But for the bronchiectasis underwent the double lung transplantation as evidenced by the clamshell scar, the bilateral thoracotomy and sternotomy scar, and also the medical address slate that's written by the double lung transplantation. And this underlying etiology of the bronchiectasis is cystic fibrosis as evidenced by the short stature, lean and thin, having anemic, having the history of the diarrhea, and also the fingertip pinprick that gives me the idea that he is diabetic. Also the evidences of diabetes that I found at the bedside glucometer, bedside insulin pen-filled insulin syringes. So putting all them together, my clinical diagnosis of this young boy is bronchiectasis, but that was treated by the double lung transplantation. Underlying etiology is cystic fibrosis. And this young boy, the bronchiectasis is not complicated by respiratory failure, as evidenced by the absence of the cyanosis, absence of carbon dioxide retention findings, as evidenced by the absence of worms, hands, and pulmonary erythema, and the flaps and the bounding pulses. And also, this young boy, the bronchiectasis or the respiratory problem is not complicated by the core pulmonary, as evidenced by the leg edema, but I'd like to examine the cardiovascular system to exclude the features of pulmonary hypertension and the right heart failure. But he's on steroid, as evidenced by the steroid purpura and also the steroid card at the bedside. So yes, my dear doctor, listen very carefully. The young boy presenting with the respiratory system, and you should think about this cystic fibrosis. Usually what happens? The cystic fibrosis causing the bronchiectasis, and you may have the sputum pot at the bedside and having a copious sputum and coughing and giving a sputum. So diagnosis, what the diagnosis? A young boy with a copious sputum, the bronchiectasis due to the cystic fibrosis. But in his case, what we found is a treated case, the double lung transplantation already has been done. And I hope that the young boy with the double lung transplantation for the bronchiectasis due to the cystic fibrosis and the case that might be interesting case that you enjoyed a lot. I hope that you learned a lot, my dear. Thank you very much.